Frankston is a 60-bed rehabilitation hospital. We have a wide range of clinical programs, from orthopaedics to pain management through to chronic diseases, cardiac, pulmonary or oncology. But we also look in specialty areas such as movement disorders, so we actually cater for patients with Parkinson's.
I work predominantly with people with neurological conditions such as Parkinson's. That's a big area of work that I do here at St John of God.
Over the last 12 months I've been coming to St John of God from the Parkinson program. Having got into it, I found it very beneficial.
For Frankston, we have invested in our chronic disease programs, in particular movement disorders and Parkinson's.
What happens with Parkinson's disease is that movement and voice grow softer and smaller in amplitude. So it's about exaggerating that and practicing it, so based on the neuroplasticity, which we know now is a vital part of improvement for people.
The Pablo device is actually developed by a company called Motion, and it's a modern assessment and also a rehabilitation device, so retraining of people's motor function. If somebody can't use their hand or their arm, then it's retraining how to use their arm or hand. So it's for the muscles, but it's predominantly so the message going from the brain down to those muscles is getting retrained, so developing new pathways in the brain.
I'm not technically inclined, but I think my granddaughters would be very impressed with me today.
Some of the benefits that I've noticed with the Pablo system, I've noticed that they can increase their grip strength and also their shoulder range of movement. There's some wrist movements that can really make gains by using Pablo, and there's the ball, which is one of the devices that we can use that can really help with supination and pronation of the arm.
It got my strength back, and I enjoyed the repetition of doing it each day.
Well, I think everybody recognises that technology and innovation in health, you have to be part of it. And our aim here at Frankston is to look at upgrading our current Pablo and moving towards a Motion lab, which will provide robotics and sensory devices for all parts of the body, from the brain to the lower limb to the upper limb.
It takes people's mind off the fact that they're actually doing therapy, so they're not counting the number of repetitions that they're having to do to go through a certain exercise movement, but they're engaging with the game, and it's almost like their mind is on doing well in the game, and they're enjoying it, they're being motivated to make those movements.
I feel far more confident. I found it extremely helpful to me all round.